welcome to Health Education Series with Nurse B. Today we'll be talking about convulsions, basically convulsions in children and first aid management. Convulsion is a medical condition characterized by violent, irregular movements, which is reflected by contraction and relaxation of body muscles. This may be due to disruption of nerve cell activity or the electrical activity of the brain. The nerves are responsible for transport of information from the brain to the body organs. The convulsion may also accompany impaired or complete loss of consciousness. This experience may be dreadful and frightening to caregivers or parents when it happens to a child, so they implore all possible measures or therapies just to disrupt the convulsion. Convulsion on its own is not outrightly dangerous, but people have a wrong notion about it. It is common to children between the ages of 6 months to 5 years and is estimated to occur in 1 in 25 children. Okay, let's consider the causes of convulsion. It may be attributed to severely high temperature. The baby's brain is not so developed to cope with high temperature, so it might break down with convulsion. Minor infections like infection of the ear, of the throat, may also lead to convulsion. Flu. If a baby catches flu, the baby might also break down with convulsion. We'll consider some misconceptions and wrong home remedy people practice. When a child is convulsing, there's usually little or nothing you could do. So a wrong intervention would only probably complicate the condition and create a painful post-seizure experience for the baby. In some parts of the world, people use cow urine concussion prepared with basil leaf, garlic, poured and soaked in cow urine for a period, and then when the child is convulsing, it's sprinkled on the child's body or even given to the child to drink. But it is ironical that this concussion is known to even induce convulsion. It could lead to skin irritation, even blindness. Other places use alligator pepper and onions in the eyes of the child. The child's eyes might be sensitive and as such irritated. Some people even believe that when a child is convulsing, the child is under an attack. So the child is taken to a spiritual home where the child is beaten, chained, a metal object used to depress the tongue, or even poured cold water, which are wrong practices. You might just end up injuring the child. There's usually little or nothing you can do when a child is convulsing. A convulsing child may present with symptoms of involuntary muscle spasm or jerking, vigorous shaking of the body, rigidity of part of the body or the whole body, muzzle twitching, drooling of saliva, squinting of the eyes, arching of the back, while the child's back will be arched, clenching of the fist, impaired or total loss of consciousness. We'll consider the first aid management of convulsion. First, when a child is convulsing, you need to stay calm. Be assured that it is not contagious, that if you touch the child, you won't contract it. Allow the child to fit or convulse. Do not move or restrain the baby. Don't forcefully hold the baby down, because this might cause dislocation. Do not attempt slapping or beating the child just to wake the child up. Remove all potentially harmful or dangerous materials from the vicinity. Keep the child safe. If the baby is on a rough surface, you could pad the baby's head with a soft pad or pillow. Create space or ventilate the environment. Remember, we said this baby might be convulsing due to high temperature, so you need to ventilate the environment so the air helps to calm the baby's temperature. Do not put anything into the baby's mouth. This may lead to aspiration, but I know this is contrary to the belief that when a child is convulsing, if nothing is put into the mouth, the baby might bite the tongue and swallow it. That's not true. You can remove tight clothing if it is observed that the tightness of the cloth is obstructing the baby's airway and is reflected by difficulty in breathing. You have to note the duration of the seizure, when it starts and when it stops, because this history might be asked in the hospital when you take the child to the hospital. When it's noticed that the seizure is ceasing, you can put the child in the recovery position. When the seizure stops, only then can you give the patient or the baby something to eat or drink, because that time he's conscious and he will not aspirate whatever is given. But if after the seizure it is observed that the baby sustained injury, or the seizure was recurrent after one episode another took place, or it's longer than 5 minutes, then you should take the baby to the hospital. Although convulsions may be alarming, they are rarely dangerous, but most times it's advisable to seek medical advice to rule out any possible underlying medical condition that could have sprouted the convulsion. I hope this video was helpful. Share it with your friends and family, and do click on the subscribe button, turn on the notification bell to get updates for my next post. Thank you and bye for now.
This city never sleeps. I hear the people walk by when it's late.